My name is Dr. Frank Vicini. I'm a radiation oncologist. I work for PrecisCa and Michigan Healthcare Professionals in Michigan. I'm a breast cancer specialist dealing with primarily clinical applications of newer forms of radiation therapy and, of course, clinical trials in breast cancer research. The patients diagnosed with invasive breast cancer treated with breast-conserving therapy, meaning lumpectomy, who are candidates for accelerated whole breast irradiation, it's quite broad, actually. Accelerated whole breast irradiation is simply the delivery of whole breast irradiation in 3 weeks, as opposed to the standard 6 weeks of whole breast irradiation, which was used to demonstrate the equivalence between breast conserving therapy and mastectomy in multiple randomized trials. So it's really just the delivery of the same total doses of radiation with the same short-term and long-term toxicities, minimal toxicities, and the same cancer controlling probabilities, but it's done in a much shorter period of time. Overall, as a general concept, the trends in radiation oncology are to provide shorter treatment schedules, if at all possible, to improve quality of life of patients. So accelerated whole breast irradiation is one of those techniques that is designed, again, to provide the same outcome in terms of cancer control and long-term toxicities, but given in a much shorter period of time. There have been multiple prospective randomized trials which have conclusively demonstrated the equivalence between accelerated whole breast irradiation given in 3 weeks versus 6 weeks. So there's plenty of data out there to support its utilization. In addition, the American Society of Radiation Oncology again has provided consensus guidelines on the application of whole breast irradiation after lumpectomy. And again, it's quite broad. Generally speaking, most women over 50 years of age who are not considered for treatment of the regional lymph nodes are most likely candidates for accelerated whole breast irradiation. There's less data on its use in patients who've received adjuvant chemotherapy, on some younger than age 45, or even in triple negative disease. That doesn't mean these are contraindications to the utilization of accelerated whole breast irradiation, but certainly there's less data to support its use at the present time. In addition, there's been recent data showing that the 3-week accelerated whole breast irradiation can even be reduced possibly to 1 week or less. There's been a recent study published on 4,000 women in the UK delivering 5 days of accelerated whole breast irradiation. These patients now have been followed for 5 years and shown to have the same local control as 3 weeks of accelerated whole breast irradiation and the same acute and chronic toxicities. But again, this is one phase 3 trial, so we're awaiting additional data before we shorten the courses down to less than 3 weeks. But nonetheless, overall, as you can see, the trends are to reduce the overall treatment duration of radiation therapy for the purpose of improving quality of life of our patients. And again, accelerated whole breast irradiation is one of those techniques designed for that purpose. It's also being explored in patients who require regional nodal radiation therapy and in those patients who receive post-mastectomy radiation therapy. But certainly the number of data and the duration of those trials that have tested this technique are much less.